Let's just begin with a sign of the cross, and then we'll continue. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. So hopefully you've made your acquaintances outside. You've got each other's contact information so you can keep in touch about spreading the truth for life and for family, and on this most important issue as well. Now it gives me great honor to introduce to you Professor Cicero Coimbra, both a medical doctor and a doctor of philosophy in the area of neurology. Dr. Coimbra is an associate professor of neurology and neuroscience at the Federal University of Sao Paulo in Brazil. He's the director of the Laboratory of Neuropathology and Neuroprotection and president of the Institute for Investigation and Treatment of Autoimmunity. He has authored many research articles, especially those regarding the treatment of severe brain injury with hypothermia and vitamins. Dr. Coimbra.
Good afternoon. I hope my English is good enough so that you can understand me. I apologize in advance for any mistake. I will start just by showing briefly the case of Zach Dunlap that Paul has just showed you. I'm really interested in showing you the interview with the doctor.
This 21-year-old coming back to life. Do you have any sort of medical explanation that you know of?
I don't.
Were any mistakes made, or was the process rushed along in any way to declare him brain dead because the family made you aware that he was an organ donor?
No, we didn't rush anything along. We certainly don't do that.
We saw the test. We saw it. They followed every procedure. He was gone.
So there was no blame.
There's no blame in a miracle. There is. And there never will be for us.
While tests can be fallible, Zach's doctors insist the results of his were accurate. And that the hospital would have detected Zach's renewed vital signs before any organ harvesting. While doctors here haven't been able to explain from a scientific standpoint Zach's return, they said the 21-year-old's youth and good health prior to the accident worked in his favor.
I was graduated in 1979 in Brazil, and I finished my medical training in the Jackson Memorial Hospital in Miami in 1985. When I finished my medical training, I was extremely disappointed with my own medical specialty, neurology, because there were almost no effective therapy for neurological patients except maybe for epilepsy. I will skip this this first slide. Let's go on. Then I decided to stop working with patients for a while, and I decided to go and have some training in research. I started doing research with experimental animals, trying to develop new possible therapeutic approaches for patients with brain injuries and brain damage, especially ischemic brain damage. This is the angiography. The technician scan that was done in Zach Dunlap's brain to show that there were no signs of brain blood flow. And you see how these tests are considered to be reliable. And the first thing that I would like you to tell you is that actually there were brain blood flow. Otherwise, he would not be giving interviews even now to Paul Byrne. And there is a difference between no evidence of blood flow and no blood flow at all. So that means that the tests that we have been using in clinical practice to detect brain blood flow are not reliable. Paul has also showed you those images. Those were statements by the family of Zach Dunlap. And here you see what Paul Byrne has already showed you. When I started doing research, I had to review all basic sciences like molecular biology, genetics, immunology, and things like that. Because if you don't know, if you don't study profoundly those issues, you will not be able to raise other new therapeutic approaches in any specialty. So in 1997, I was interviewed by Brazilian press, and I told them what I'm about to tell you now. And just because of that, the transplantation system in Brazil tried to revoke my license to work as a doctor. And that was finished only last year, by the beginning of last year. After almost 20 years, the Brazilian courts stopped that. So I've been working as a doctor in spite of all attempts to revoke my medical licenses, and just was because I told the press what I'm about to tell you now. So you see the cranial vault, you see the brain tissue, you see the blood vessels. This is just a sketch, of course, and this is the intracranial space where there is normal intracranial pressure, normal blood flow, and this is what happens when there is a brain injury. There is swelling of the brain edema. There is increased brain volume, and because the cranial vault cannot expand, the result is increased intracranial pressure, and that compresses the blood vessels. So by 1968, when brain death was introduced in medical practice, they thought that it was just a belief. They thought that when there would be no signs of brain activity, the only possible explanation would be complete absence of blood flow. Okay, but later on, like 15 years later, we knew that when the blood flow is reduced so that it is between 20 and 50% of the normal level, there is no enough energy to sustain synaptic activity. So the brain will be silent, but there is enough blood flow to keep the brain cells alive. The reason why I'm telling you this is because there is no way to fight the economical power of transplant system without knowing what is really going on, without knowing pathophysiology. I had to study pathophysiology profoundly in order to do research about that. Pathophysiology is the science that studies the mechanism of diseases. So we have to know the mechanism of diseases. Knowledge is the only way to fight lies. So this is a fantastic opportunity to tell you in layman terms what is really going on in the brain of those patients, so that you will know why Zach Dunlap has recovered, so that you know what you have to do in order to induce recovery in other patients. Okay. When we have the blood flow is reduced to between 20 and 50% of the normal level, this is called global ischemic penumbra, meaning that you have a silent brain, but the brain is still alive. And what we can do in order to induce recovery. You have seen that Paul talked about giving thyroid hormones. And now I'm trying to explain to you why thyroid hormones should be given to those patients. So you see that in the middle of the brain, you have this area that is called hypothalamus. Hypothalamus produces hypothalamic releasing hormones. And among these hormones, you have the TSH, which is the thyroid stimulating hormones that is released in the circulation. So when when the blood flow is reduced to the range of ischemic penumbra between 20 and 50% of the normal range, TSH is reduced. And that means that TSH that should stimulate the thyroid gland to produce the thyroid hormones TH3 and TH4 and release them back to the brain tissue, that stimulation is reduced. And because that stimulation is reduced, these patients are in a situation called central hypothyroidism. And this is a lethal situation. If you don't give thyroid hormones, they will die. And those patients never received thyroid hormones in any part of the brain, of the world. And they are said to be fully treated when actually they are not receiving even the minimal treatment that they would need in order to recovery and survive. Recovery means recovery to normal life. This is not taught to medical students. This is not taught to medical doctors. Doctors do not know pathophysiology. They just follow protocols. And they don't think they are taught not to think about what they are doing. They are taught to follow protocols. And that's all. That's why Paul Byrne received that answer. It's not indicated. It's not indicated because they are not thinking about what they are doing. They don't have the knowledge of pathophysiology that they should have. They are not receiving proper information. It's not their fault. It's the system. I am a professor in my university, and I know that medical students do not receive any information about mechanisms of diseases. But they believe that they have the most important information, the essential information. They hold the information necessary to properly treat patients. Actually, they do not. Okay, these are some of the publications that were recently made. This is 2015. You see that the thyroid hormones have anti-edema effects on the brain after brain injuries. Nobody gives thyroid hormones to victims of brain injuries. This is the what we call the brain-blood barrier with thyroid hormones. When those patients have reduced production of thyroid hormones and they are in the condition called central hypothyroidism, the brain-blood barrier is disrupted, so that now the brain develops what we call brain myxedema, meaning that without thyroid hormones, there is a release of fluid from the intravascular space into the brain tissue. So if you don't give them thyroid hormones, which is the duty of any doctor, patients should not be left without proper treatment. So if you know that a patient has a lethal disorder, you are obliged to treat them. This is just to show you that astrocytes pick up thyroid hormones and they activate thyroid hormones and release it into the neural cells. You see that this is an article, a review article that was published last year. So patients that are victims of traumatic brain injury, or so-called TBI, as the article says, with low serum TH4, low serum thyroid hormones, they need thyroid hormones supplementation. Okay, this is what I just showed you. And this is what happened when you don't give thyroid hormones, that brain edema would progress and completely stop brain circulation. So if you don't give thyroid hormones, it's hopeless. And my aim here is to provide information that hopelessly comatose patients are not hopeless anymore, provided that you spread information, provided that information like that appears in places like YouTube, so that patients will know what was happening and they will ask their doctor about that. They could ask their doctors to see information in YouTube. They cannot have the argument to say that it's not indicated. Of course, it's indicated. It's their duty to do that. They are obliged to do that for medical ethics. Okay, this is when the first paper was about central hypothyroidism was published. That was back in 1988. So hypothyroidism is a lethal disorder consistently left untreated in victims of severe brain damage. These potential organ donors, supposedly receiving maximal intensive care, are actually denied a life-saving hormonal therapy and submitted to the lethal apnea test. I will tell you just within a few minutes why apnea test is lethal. Okay. Apnea test is performed in patients with the most severe brain injury. When Glasgow, there is a scale of coma that all medical doctors, especially neurologists and neurosurgeons, know as the Glasgow Coma Scale. So you are now, and as I am, in the Glasgow Coma Scale of 15. So as coma progresses, becomes deeper and deeper, at some point it will be reach the lowest grade, which is the grade 3. And then when they reach the grade 3, they will, medical doctors will start screening for brain death. But before that, when the Glasgow Coma Scale is at 7 or 8, most patients, if not all patients, are already having low levels of hypothyroidism, and their brain edema is actually brain myxedema. if they are not receiving, if they do not receive proper treatment, which is thyroid hormones replacement, they will die. They will progress into complete arrest of the brain circulation. So the respiratory centers require thyroid hormones to respond to apnea. And those patients are profoundly in a profound state of hypothyroidism. They are not given thyroid hormones. Because the brain blood flow is so low, the respiratory centers do not respond to apnea test because the levels of thyroid hormones are so low, the respiratory centers do not respond to apnea test, which is considered to be a fundamental test to declare brain death. Okay, this is another paper that has been published about the same thing, about the importance of thyroid hormones to the recovery of brain injury, victims of brain injury. You see, this is a study that was done in experimental animals, showing that when you give T3, which is the active form of thyroid hormones, there is an improvement. We can see the functional recovery of the brain. So there are several biochemical pathways that are involved in this effect, this modulation of nuclear factor called alpha, and F alpha beta is also involved. Also, there is also a reduced number of apoptotic neurons, meaning that the neurons that are dying are reduced when you give thyroid hormones. So there is also increased production of substances called neurotrophins that are neurotrophins are required to keep neurons alive, and thyroid hormones induce that production in the brain of injured victims. Thyroid hormones that is also have also potent anti-inflammatory effects, and the brain is extremely sensitive to inflammation because of a phenomenon that is called lipid peroxidation. So, in addition to low levels of thyroid hormones, the malfunctioning of hypothalamus also reduces the stimulation of adrenal gland. That means that corticoid hormones produced by adrenal glands are reduced. And because of mineral corticoid hormones reduction, the blood pressure of the patient goes down. So you have increased intracranial pressure, compressing blood vessels, and you also have decreased blood pressure that is necessary to sustain normal blood flow to the brain. So those two problems are happening in severe victims of severe brain damage, and they are not corrected. But they are told, the doctors believe that they are giving the best treatment. They are not giving treatment at all, any treatment at all. So in 1994, there was this report by Géret and Benjamin that showed that up to 40% of patients that are submitted to apnea test, which is necessary for the declaration of brain death. 40% of patients had reduction of blood flow during the apnea test as a consequence of apnea test. They even found some patients that had irreversible cardiac arrest during the apnea test. So apnea test is lethal. It further reduces the brain blood flow that would be required to respiratory centers to respond to apnea test. So there is reduced perfusion pressure because of decreased blood flow, blood pressure. The increased concentration of CO2 that is induced by apnea tests further increase the intracranial pressure, further compressing blood vessels. And if you induce hypotension in animals with increased intracranial pressure, you will induce irreversible collapse of the blood flow to the brain. So apnea test actually causes irreversible brain damage. Not only it's proposed to diagnose irreversible brain damage, but it causes irreversible brain damage. And that's why I was fighting for almost 20 years to prevent to keep my license to work as a doctor. Okay, let's see. Okay, this is, so you have the brain blood flow on the left side, and suppose that you have a patient that had a severe head trauma at time 0 hours, and then as the brain edema progresses, intracranial pressure increases and the blood flow decreases progressively. So in the first horizontal line, the one that you have here shows the upper limit of the ischemic penumbra zone. So when the patient blood flow reaches this level, crosses this level, then there is no signs of non-neurological signs. I mean, you can do any neurological examination and you won't see any response from the brain. But the brain is not dead. It's only silent. In order to cause irreversible brain damage, you have to cross the second horizontal, the yellow one, which is the line of necrosis. If you induce apnea test, you will kill this, you will irreversible damage that brain. And this is done in all patients that are screened for brain damage. Okay. There are several complications of apnea tests that are done in patients that are defenseless. These are some of them that have been reported in the medical literature. So if you, in patients with so-called brain damage, brain death, you have adrenal failure, hypothyroidism, and apnea test causing intracranial circulatory arrest. And everything could be avoided. So those were at least some of the substances that should be given to those patients in order to optimize neurological recovery. This 39-year-old Portuguese descendant female was diagnosed as having brain death in April 8, 2011. The family asks me to try to do something about it, and we gave her 200 micrograms of T4 per day, divided into 2 doses. She was profoundly hypothyroid. So she was receiving 100 micrograms of T4 twice a day. Some other substances that I found to be important for optimizing brain recovery. And she resumed spontaneous respiration, fully independent on medical ventilation on April 18. So it was only 8 days after she could breathe on her own. By the middle of May 2011, she could be communicated with her father and mother by lip reading, but she died because of a massive pulmonary embolism in July 2011. Okay, so those hypopituitarism, I mean low levels of hypothalamic releasing factors leading to low levels of several important hormones for survival of any patient is found in all those clinical circumstances. And all of those patients are probably at some point, most of those patients at some point are submitted to testing for brain death. Okay, those are reported in several papers in the literature. Hyperthermia, fever, is frequently found on those patients and cause increased brain edema. But those patients did not even receive drugs to reduce their body temperature. So not even minimal treatment is given to those patients. Okay. Okay, the fact that the hypothyroidism prevents the response to apnea tests has been published since 1964. Okay, this is something really, really, really important. I was in 2007. I was called by the family of a 15-year-old girl that had a severe brain trauma, and I started giving her thyroid hormones, but that was a month after the trauma. It was too late. But after, when I started giving her thyroid hormones, just like 2 weeks later, she was having seizures, and she was controlling the respirator again. So I wrote in her medical chart that a dead brain cannot seize, cannot have convulsions, cannot control the respirator. And this is what the doctor that was on call read my statements, wrote. If the diagnostic criteria for brain death are fulfilled at a certain time, the person is legally dead, no matter what those criteria become no longer fulfilled later on. So then you can understand what is happening, what is at stake when we are threatening the system of transplantation. Okay. There's my suggestions that patients should never undergo apnea test. They should be properly treated by receiving proper hormonal replacement. This is the reason why I was. They tried to get to revoke my medical license. Transplant surgeons are wealthy and politically powerful professionals in world-leading medical centers like USA, where private medicine is allowed and praised. They hold decision-making positions at medical institutions, including medical councils, medical associations, academies, universities, hospital board of directors, and departments of health of most countries. This was published in the Wall Street Journal 24 years ago to say how much money is involved in medical transplantation. Last night I was just trying to look for new data, and I found this announcement that was made in 2018, I guess. This is only related to USA. They believe that the amount of money involved in the transplantation system will double by 2025, and this is probably an announcement to suggest that their shares should be bought in order to get profit from this system. This is how it's the amount of money involved is raising, only in the United States. So you imagine what is the amount of money involved worldwide. So the two basic principles of medical practice are simply ignored when you perform the apnea test for diagnosing brain death. The first principle is non-maleficency. You should not cause damage to your patients. This is the first most important principle of medical practice. And the second principle is doing the best you can for your patients. So you don't give thyroid hormones, you don't give other hormones that are extremely important, fundamental for the neurological recovery and for survival of those patients. So both principles are simply ignored. Okay, so at some point you will start asking, okay, but patients with hypertension or diabetes, they damage their organs, like kidneys, like heart, and they need new hearts, new kidneys, so that they can survive. Actually, this is a knowledge that also is not given to medical students. The reason why patients have hypertension, the reason why patients have diabetes. So this is one of the most important reasons. Because of the lack of exposure to sunlight, like 90% of the world population has low levels of vitamin D. And vitamin D is not a vitamin. It's a powerful hormone-like substance which has a wide range of biological effects in our body. One of them is to control our blood pressure. And 90% of the population has low levels of vitamin D. So I just saw this last night. If you go to Google, academic Google, and write vitamin D and hypertension, you have 261,000 publications, but there is no information in the textbooks of medicine about that. Regarding vitamin D and diabetes, last night I could see it's 275 publications, but again, not a single word in medical tests. Magnesium is a critical mineral that is involved in absolutely all metabolic cell pathways. And 80% of the Western population has low levels of magnesium. And those low levels of magnesium cannot be demonstrated by blood tests. So I also was looking at academic Google, Scholar Google, I'm sorry, and I could see that there is now 145,000 publications about the importance of magnesium to prevent and treat diabetes, but absolutely no word in the textbooks of medicine, because otherwise you will have less patients with diabetes. You will sell less insulin. You will sell less hypoglycemic drugs. You will sell less antihypertensive drugs, because medical doctors do not know the cause of hypertension, do not know the cause of diabetes. Magnesium and hypertension, there was more than 300,000 results in the Scholar Google last night. No, not a single word about the importance of replacing magnesium in the textbooks of neurology, of cardiology or medicine in general. Thank you very much.